So, welcome to the show. I'm joined by my guest, Dr. Christie Drzewiecki from the Neuro Wellness Institute here in Chicago. Thank you for joining me, Dr. Christie.
Of course. Glad to be here.
Yeah. So, we want to talk today about anxiety, and you've got a lot of interesting perspectives and expertise in the field of anxiety, or in the topic of anxiety.
Yeah. So, anxiety can be, well, first of all, I think that it's the people that I see, they're almost nervous to, they're anxious to tell me that they're anxious just because they think it's not mainstream. Yeah. And I think anxiety is much more prevalent than what people realize. And so people don't necessarily come out and say they have anxiety or anything like that, but any type of wind up, any type of where your brain is just going, or your heart is going, or you just feel like you're wired, essentially. I mean, that is all a form of anxiety. Yeah. And so I think it has a bad stigma surrounded. You know, if someone says that they're anxious, then it's almost deemed as uncommon, but it's very common. At least 40 million Americans have anxiety, and really only 40% of those are being treated properly. And there's multiple things that can contribute. So a lot of what I want to talk about is the parts of the brain that are involved, the different therapies that are involved, and also what may be contributing, because some of those things are pretty surprising. You know, there's a lot more, there's external factors and internal factors when it comes to anxiety.
Excellent.
Yeah.
I'm excited to dive deeper into all the contributing factors. Just so we have some background on you, what's your background and how did you get interested in the topic of anxiety?
Well, my background, I have a doctorate in chiropractic. I specialize in functional medicine, so I'm a certified functional medicine practitioner, and I also practice neurofeedback training as well. My interest with anxiety actually is more of a personal story. I had a lot of, starting out probably 10, 15 years ago, a lot of anxiety, a lot of gut issues, digestion issues, all of those things. Not really diving deep into functional medicine until that time. And when I did, that's when a lot of my digestive issues started to clear up. My gut was healing and my anxiety was reducing. I was able to pinpoint what lifestyle factors are contributing to the anxiety, which ones are not, which ones, how food is affecting it, you know, how your brainwave activity, you know, getting into the neurofeedback training, how all of that is playing a role in anxiety or hormonal imbalances. So a lot of it is from a personal standpoint, just that interest and passion to figure out where that anxiety is stemming from. Yeah. And it's different for everyone. You know? Yeah.
And that's a lot of times how people really find the thing that they love treating, is they find a way to, you know, help themselves. And
right.
Yeah. So you had mentioned a little bit about the gut and diet and its relationship to anxiety. Mm-hmm. Can we go down that path a little bit?
Yeah. So as we know, the brain and the gut are highly connected. So the brain affects the gut affects the brain. From a gut standpoint, it's really fascinating because obviously what we eat, our gut is responsible for digesting that food and absorbing the nutrients from those foods. A lot of those nutrients are nutrients that we need to make the neurotransmitters that are in our brain. So B6, zinc, even copper, things like that. We need those things. Iron's another one. We need those to make serotonin, to make dopamine, to make all of those hormones that are involved in helping to keep us calm. So we have that aspect from a gut perspective. We also have our gut microbiome, which is all of the bugs in the gut. All of those bugs produce different toxins that either inhibit certain areas of the brain or cause them to fire faster. So if your microbiome is not necessarily healthy, if there's a lot more bad bugs than good bugs, or even if there's a lot more good bugs than bad bugs, it just depends on which bugs there are. But that can definitely affect the brain and the neurotransmitters that are being produced and the signals that are being sent out from the brain. So if we're constantly getting feedback from our gut, from the bugs in there that are telling the brain to do certain things, and that's where the anxiety can come from too. So making sure that you have a healthy gut is really important from an absorption standpoint and a microbiome standpoint.
Okay. And just piggybacking off of that, what are some ways that people could avoid, promoting bad bacteria in the gut versus cultivating, proper good bacteria in the gut?
Yeah, so definitely it's very individualized. There is different testing that you can do out there to determine what your microbiome looks like. There's a lot of different companies out there that have very good testing right now as far as stool testing. So there's the individualized piece to determine which ones are high and which ones are not, because you have to take into consideration pathogenic bacteria that maybe needs to be treated. But some simple things that you can incorporate are, as long as you can tolerate it. A lot of people have a hard time tolerating things like fiber and things like that, but fiber in the form of sweet potato or the vegetables like asparagus, anything like that is going to feed the good bacteria in the gut. So that will help to kind of feed what you already have, but then also looking at a good probiotic to supplement with. Just because a lot of things that we expose ourselves to today, as far as the pesticides, herbicides, some of the things that are put into our food tend to kill off some of that bacteria. So the replenishing with a good probiotic is probably ideal.
Okay.
Yeah.
And what are some foods that, or some things that might be negative that we can avoid?
Any type of artificial sweetener will definitely kill off your good bacteria. Anything that is, obviously we can't buy, it's hard for us to buy 100% organic all the time, but the more we can buy organic, the better. So looking at the quality of your food and making sure that there's nothing that's really going to kill off the bad bugs. I'm trying to think of some others.
Like sugar, obviously.
Yeah, sugar can feed a lot of the bad bacteria in the form of like high fructose corn syrup and things like that. We're going to, it doesn't necessarily need to be 100% sugar-free because fruit has sugar, fruit has fructose, things like that. So, but plain white high fructose corn syrup is probably not the best. It's going to feed some bad bugs. Yeah.
Okay.
Yep.
So we kind of touched on kind of the diet and the gut and maybe the functional medicine side a bit. And you said your other expertise was in the neurofeedback training.
Yes.
So what are some things that you see from a neurofeedback standpoint in your experience?
Well, I'll start by saying the reason that I started to study and learn and implement neurofeedback training is because with what I was doing from a functional medicine perspective, I was working with a lot of middle-aged females who were very anxious. So we were trying to calm down the anxiety, but we were also implementing all of these protocols that were almost causing more anxiety at the same time. There's just a lot to follow, a lot to take in, a lot to consider. So we would implement these things and we would make minimal changes. And so we were trying to figure out what the culprit was. Obviously we've addressed the gut, we've addressed the diet, we've addressed stress, we've addressed it all, and they weren't really budging in a positive direction. So implementing the neurofeedback training has been more of a passive therapy that addresses something from almost like a higher level. So looking at your brainwave activity to determine if there's too much activity going on and retraining that activity to calm itself down, to help to regulate your whole system, and the way that the messages are being sent through the brain, body, all of that. So to essentially calm down that ramped up fight or flight state. And so once I implemented that, it's been phenomenal. It's definitely helped on multiple levels. I've had people with anxiety, fatigue, brain fog, hormonal imbalances, sleep problems, just by addressing the imbalance in the brainwave activity. A lot of that has just normalized just by calming them down in general. So addressing it from that standpoint has helped everything else down the ladder.
Excellent. Yeah. And it's really a multimodal approach then at this point.
For sure.
For those who aren't aware, I know we're going to have a whole show on neurofeedback, but if you could touch on maybe what neurofeedback is and maybe what it would look like for somebody with anxiety.
Yep, for sure. So neurofeedback is looking at your brainwave activity. So it's looking at the brainwaves delta, theta, alpha, beta, and gamma. Generally, with neurofeedback, if anxiety is a contributing or is a symptom that they're experiencing, I've seen various patterns when it comes to that, but for the most part, I generally see an increase in beta wave activity. Sometimes I'll see a decrease in alpha wave activity. And what we do is we retrain, for example, if beta is high, we'll retrain the brain to calm that beta wave activity down. So we're retraining the brain based on reward. And in the past, working with patients, we've had quite a bit of success doing that to where their anxiety calms or sleep improves. But that's generally the pattern I see, and it's different for everyone, just depending on where the anxiety is stemming from. But generally, I see higher beta and sometimes lower alpha.
Okay.
But I've also had people where they're anxious, they're ramped up, they just can't calm themselves down, and their brain map looks amazing. So yeah, it really is different for everyone as far as where the anxiety is stemming from.
Yeah, and then we got to look into these other things, like you said, the gut, maybe how they're functioning neurophysiologically.
Yep.
With some of the other things that we offer here with the functional neurology training.
Yep.
So, going into that then, what are some, brain areas that or brain anatomically and physiologically brain areas that you found contribute to anxiety or tend to go awry in anxiety?
Yeah, and that's where, so as far as the structures of the brain go, the limbic system is obviously a big contributing factor to anxiety. And we're looking I'll start with that. I'll start with the limbic system, but there's a little area in the brain called the amygdala that is our fear center in the brain. And so even subconsciously, our amygdala is going to pick up on things that should be perceived as a threat, as something that's scary or causing fear. And that's when our heart starts to race. That's when we start to breathe faster. That's when our blood starts pumping because we're getting ready to get away from that threat, whether it's run or fight or whatever it is. So it starts there, and then that message goes to the cortex, and then we use our conscious brain to determine, is this an actual threat? So if it is, then the amygdala is just fueled to continue getting the body ready to fight that threat. At the same time, other areas of brain like the hypothalamus, it is sending out different hormones like cortisol, epinephrine, norepinephrine to just keep it going, to get that body ready to fight. And so once that cycle starts, a lot of times with anxiety, it just doesn't stop. That's our sympathetic response. And generally, that sympathetic response should be balanced by the parasympathetic response, which is our rest and digest state. But in people with anxiety, that side of the autonomic nervous system is it doesn't show its face very often. Yeah. So that's what happens. It's a very basic idea of what happens from a neuro standpoint as to how that that system starts to ramp up. But it also has to be, we also have to remember that, yes, what we see and what our external environment is, what it looks like can be perceived as a threat, but also internally too. We talked about gut health. We talked about different foods and things like that can be considered a threat internally, but also hormone imbalances, or if there's a concussion, abnormal eye movements. All of those things are, your body senses it as this is not right, and so it puts itself in a state of anxiety because it's not really sure what's going on. And so that's where that wiring just keeps going, because that threat is always there. So it's our job, from whether it's a functional medicine perspective, neurofeedback, functional neurology, to determine what that trigger is, and then calm that down to remove that stressful pillar.
Right.
Yeah.
And I love that you brought up the interplay between the sympathetic and the parasympathetic nervous system.
Yeah.
And how crucial that is. Can you kind of talk on the relationship between the two, and how when one might be dysfunctioning, the other might be functioning too high or whatever?
Yeah. So, like I said, the sympathetic nervous system is our fight or flight response. It's part of the autonomic nervous system. The autonomic nervous system is what controls everything that we don't have to think about: heart rate, breathing, blood pressure, all of those things. It tends to fire too much when there's something out of balance, when the body's in a state of imbalance, so to speak. So whether or not it's something that's more neurologically related or physiologically related, as far as gut health and hormones and all that, it's all perceived as a threat. It's the job of the parasympathetic to balance that out, as long as the sympathetic side can calm down. So if the sympathetic side is just ramped up and just going, it's very difficult for a parasympathetic system to increase as it should, because they work in opposites. So when one's high, the other is low, and one's and vice versa. So when the sympathetic nervous system is working in excess, then the parasympathetic tends to calm down, because in at that moment you have to be on guard. You have to be ready to fight or flee. So from that perspective, it's our job to, one, decrease that sympathetic response, but also focus on increasing the parasympathetic response. Maybe looking more at and this is kind of a stretch, but looking more at vagal nerve activity, seeing how that brain-gut connection, because that's our main parasympathetic nerve there. So
because then now you're looking at the brain to the gut now, and if the part of the brain that's supposed to be bringing blood flow and stimulation to the gut isn't working appropriately because the sympathetic nervous system is too high, now our gut's not working. It already wasn't working because we weren't feeding it the right fuel potentially. And now there's this just vicious cycle that we've got. So I think that's very important. Shifting gears just a little bit with the hormone side. So what are some imbalances hormonally that you've seen play a role in anxiety?
I actually see a lot of imbalance between estrogen and progesterone, especially in females. I've even seen imbalances in progesterone in males as well that contributes to either anxiety or some other form of mood disorder. So I think that's something that is highly overlooked when it comes to anxiety, and I think that it plays a major role. For females, progesterone is essentially a calming hormone. But at the same time, estrogen is something that is neuroprotective, so it's protecting our brain, helping our frontal lobe to function optimally, to kind of navigate through what is an actual threat and what is only a perceived threat from a wind-up. So looking at those two hormones specifically, when it comes to the sex hormones, I think is ideal to determine if there's a hormonal piece contributing. usually lower progesterone, usually, not all the time, but sometimes that can be a major contributing factor for anxiety.
Okay.
Mm-hmm.
And have you found the prevalence of anxiety is higher in females versus males?
Yeah, I do tend to see that. I do notice a trend, though, with anxiety in males after concussion. And that's when I see more anxiety, but or chemical exposure. So I do see a lot of that. Sometimes in males having lower testosterone than the optimal range, that can be a contributing factor as well.
Okay. And you mentioned chemical exposures, so that's something that's a lot of people are very weary of right now.
Right.
Can you touch on that a little bit?
Yeah, so obviously the ones that we're exposed to the most are probably the ones that are in our foods, the herbicides and pesticides. But a lot of people, and as far as their occupation, they're exposed to chemicals all the time, whether it's dry cleaning or carpentry or working at a factory or a nail salon or anything like that. They're exposed to these chemicals day in, day out. And a lot of them, from a neurological perspective, they can be damaging. They can be damaging to our brain cells. They can be damaging if we're eating them. They're damaging our gut and therefore damaging our neurology and things like that. So chemicals can play a major role in how our gut and brain are functioning, and can definitely contribute to anxiety from that perspective, just how it's being affected.
Okay.
Yeah.
And even so, outside of the maybe the industrial workers or nail polish beauticians, what about our just everyday products that typical Americans tend to use? How big of a factor have you seen that play?
That's pretty big too.
Yeah.
A lot of the cosmetics and lotions and sprays that we put on, they really alter our hormones for sure. Especially a lot of female cosmetics and lotions, they contain things that will mimic estrogen in the body. So looking at it from that perspective, eliminating what we're putting on our skin and in our hair and on our bodies, that can be something to be wary of, at least. Not saying to eliminate everything, but we have to be realistic too, but just minimizing it, just because a lot of those things do contain things that mimic estrogen or have certain hormones added to it. I know there's certain sprays out there that have a huge chance of increasing different hormones in the body that shouldn't necessarily be there. They end up competing with our own hormones, and that's where some of the problems starts to come in.
Okay. So it seems like if I come to you and I say I have anxiety, there's a lot of things that you're going to have to look at.
Absolutely. Yeah. I would definitely start with looking at it from a neurofeedback perspective to look at the brainwave activity. We would look at hormone health. We would look at gut health. So we look at your diet. We'd also look at, obviously, lifestyle factors too. What's your day-to-day life look like? Is there something that is there an emotional piece that's not being addressed? How are your relationships? How's your social life? How all of those things can really have an effect on the sympathetic, parasympathetic response and that wind up in the brain. Yeah.
So it really takes a team approach, really, potentially, to help somebody with anxiety.
For sure.
Yeah, that social aspect we didn't even touch on.
I know.
That's a huge thing too, right?
Definitely. Yeah. Definitely. More so than I think we realize.
And we give credit to, yeah.
Yeah.
Yeah, especially as we get older, I think, a lot of people, I know men in particular, have a hard time maintaining relationships, right?
Yeah.
Outside of marriage and whatnot. And you see a lot of increase in anxiety with men in later age.
Yep.
So
exactly.
That's a big factor.
Mm-hmm.
Well, this has been really great so far, Dr. Christie. I really appreciate you taking time out of your schedule to sit down and chat with me.
Absolutely.
I want to give you this chance to, give our listeners any closing remarks, any final thoughts to leave us with today.
I would say that I do want people to realize that anxiety is much more common than what people realize, and that it could be a fueling force behind a lot of your physical symptoms. So looking at it from every angle is important. Looking at it from a neurological angle, looking at it from a neurochemical angle, gut health, hormone health, blood sugar dysregulation. That's another thing we didn't touch on. But all of those things can play a major role in anxiety, and to make sure that you find a practitioner that's going to look at it from every angle.
Right.
Yeah.
And obviously we are the Neuro Wellness Podcast, coming from the Neuro Wellness Institute. This is something that you and I see pretty regularly here, and then we've worked pretty together on a lot of cases, really trying to nail this down with different patients, and I think that's a great thing that we have going here in this clinic. So
Agreed.
So if people wanted to reach out to you or to the clinic in general, how would they do that? What's the best way to do that?
Well, they could contact the office via phone, email, whatever is most convenient for them. And they can set up a phone call with one of our patient care coordinators that will give them a lot more information about our visits and how to schedule and things like that.
Great. Great. Well, again, this has been awesome, Dr. Christie. I really appreciate you doing this. But this is that's the show. So
thanks, Dr. Joe.
You're
I
very
appreciate
welcome.
it.
You're very welcome. So from your host, Dr. Coppus, this has been the Neuro Wellness Podcast. Be well.